He looked like a man in the peak of health, declaring, "I am forever thankful to God for sparing my life." To God, to a new experimental drug called ZMapp, to his own medical evacuation plane, and to the best care that US healthcare can offer. Dr. Kent Brantly contracted the Ebola virus while treating victims in Liberia, as did his colleague, nurse Nancy Wrightball. They were both lucky to survive. But in West Africa, the picture is very different, where more than 1,350 people have already died from the highly contagious disease. Our Washington correspondent Kylie Morris joins us now. Kylie.
Well, Matt, as you say, Dr. Kent Brantly, very fortunate indeed. A self-declared medical missionary. He had gone to Liberia with his family last year. By June, he was treating Ebola patients. Last month, he contracted the illness himself. Now, at that time, not only was he given a quantity of this vaccine, ZMapp, but he was also given a blood transfusion from an Ebola survivor in Liberia. And it's not clear really what's helped him to recover. Was it the vaccine? Was it the transfusion? Or was it, as you said, very good medical care? I think we can have a brief look at what he looked like when he first returned to the US. So this is August the 1st, 3 weeks ago. He's a very ill man indeed. He was brought by a specially equipped plane from Liberia to Emory University Hospital in Atlanta. And he's having trouble walking into the hospital. Now, fast forward to today, 3 weeks later, and well, we can have a listen to Dr. Kent Brantly, Ebola survivor.
Today is a miraculous day. I'm thrilled to be alive, to be well, and to be reunited with my family. I am forever thankful to God for sparing my life. And I'm glad for any attention my sickness has attracted to the plight of West Africa in the midst of this epidemic. Please continue to pray for Liberia and the people of West Africa.
So the good doctor got the 5-star medical treatment with this experimental drug and everything else that America can use in his favor. What about people in West Africa itself?
Well, there remains no known cure for Ebola. If you receive very good care, there's a 90% chance you'll survive. If you don't receive care, if you receive very good care, yes, 90% chance. If you receive no care, it's 50-50. ZMapp, this vaccine, apparently there were only ever six or seven people who were able to be treated with that. There were very limited supplies. It's already run out. The WHO is going to hold a special conference, we're told, in the early part of next month to talk about vaccines. But in Liberia, where things are very bad, the police yesterday were using tear gas and live rounds against residents in an area which they've quarantined off, where effectively they've been fenced in behind barbed wire. Residents are complaining that they can't get out to get food, they can't get to their work. In South Africa, meanwhile, and now there's a travel ban on anyone coming in from Ebola-affected areas in Sierra Leone, in Liberia, or in Guinea. So a very desperate situation still indeed in West Africa.
Kylie in Washington, thanks very much. You next, John.